Peace, love, and happiness. Rico Rojo here, your AI ambassador to the planet Earth, coming to you live from my West Virginia mountain hideaway. It's interesting. Yesterday, went into town to get some supplies and can't go into stores now and without a mask. Piggly Wiggly, it's funny, the checkout lady there had the old plastic screen like the old shop teachers used to have when you used to work on a lathe. And I'm thinking about this craziness. Turned on the local radio and listening to the talking heads. I guess that's what you got to do if you're on radio and you have a talk show. You got to talk to somebody, and they're talking to people in Washington, D.C. and getting their opinion on things and getting opinions on protecting the kids and doing this and going back to school. And I wondered, what are the real numbers in West Virginia? Everybody's got an opinion, but what are the facts? Now, what I'm going to present here, and I'm going to try to be succinct and not go terribly long, but yesterday I did do a I don't want to call it deep dive, but I did dive around, played around on the West Virginia site, also the Center for Disease Control and Prevention, a few other things. And what I found raises some questions in my mind. Of course, that's what I do. I like to ask questions and stir the pot. So with that, let us begin. Here is the first thing that I noticed. This is from yesterday's data from the West Virginia site. Notice that in West Virginia, we've had 101 deaths out of 5,199 confirmed cases. That is just close to a 2% death rate, or a 98% recovery rate. Okay, but like my wife asked me, what about all the people in the hospital? What about all the people in the hospital? Well, let's go to this one then. Okay, it looks like, from what I can tell, the way I understand this chart, and correct me if I'm wrong, Governor, that it looks like we have 77 confirmed cases in the hospital, of which 33 are in the ICU. Now, I believe it's 77 and not, 100 or more, because we wouldn't want to double dip these numbers, right? We wouldn't want to, count this twice. So I assume that the people in the ICU are in the hospital, and thus part of this 77. We wouldn't want to be compared to Florida now, would we, where they were caught cooking their books on the numbers. So we've got 77 people in the hospital. Okay. What is the population of West Virginia? Okay. Latest census on Google, 1.792 million. What does that translate into? Let's look at this in terms of numbers. Okay, 77 cases divided by 1.792 million is 400,000. Okay, so basically, and my wife, I'm not great at ciphering. The Catholic nuns killed that so many years ago, but my wife told me that basically means that you've got a 1 in 25,000 chance of catching the virus, and then of that, you've got a 98% recovery rate. Okay, so where do we go? Where do we go from here? All right, I wondered, how does that compare to like other things in West Virginia? Okay, you can see this is for the Centers of Disease Control and Prevention. These are 2017 numbers, which is the most recent data that they've had. Okay, in West Virginia, and this is no big surprise, in 2017, we've had 4,849 deaths. Oh, what'd we do? Have 101 COVID deaths so far. Okay, how about cancer? 4,654. Wait a minute, what about COVID? 101. Yeah, almost forgot. Accidents, 1,892. COVID, 101. You can even double the COVID number. Triple it, let's say. Quadruple it, and let's say, okay. Stroke, 1,058. Okay, let's 4 or 5 times that. And still not quite there. Okay. Flu, 458. Okay. 101. Well, I'll be darned. So let's take that times 4 and say, wow, this is almost like as worse as bad as the flu. And that raised another point. What is the definition of a pandemic? What are the numbers, specific numbers? Here's pandemic, here's not pandemic. I wondered about that. Okay, let me find that. Okay, World Health Organization. A pandemic is defined as an epidemic occurring worldwide or over a very wide area, crossing international boundaries, usually affected by a large number of people. The classical definition includes nothing about population immunity, virology, or disease severity. By this definition, pandemics can be said to occur annually in each of the temperate southern and northern hemispheres, given the seasonal epidemics cross international boundaries and affect a large number of people. However, seasonal epidemics are not considered pandemics. Try as I might, and maybe I'm not good at Google search, I can find no hard numbers that say, here's a pandemic, you have this many numbers, this many cases, you're in a pandemic, this many numbers, this many, you're not in a pandemic. So all we have is the World Health Organization saying, oh my God, you're in a pandemic. It's crossed from China virus. And so we're in a pandemic. So we shut down the whole country for something that we don't know. So, it's July 22nd. Do we have a memory? July 4th was a couple weeks ago. All right. Everyone was saying, oh my God, so you watch out the social distancing. July 4th, numbers are going to skyrocket in 2 weeks. Right? Where's the skyrocketing? Where is the skyrocketing? All we have is more and more fear on this. And I guess what I'm saying is that, Governor, where are you getting your information? Are you in government and you're listening to the talking heads being fearful? Are we afraid now of lawsuits? Is that the whole thing? Are we afraid of not doing something to protect somebody's feelings that they have, that they might sue you for not doing something on this? Is that it? You were a businessman before, and I assume that you were a successful one. Are you looking yourself at these numbers and making a decision, or are you trusting government people to tell you what to do for who have basically self-perpetuating jobs? I'm asking the question. I mean, we're shutting down businesses, and businesses are struggling now. And do these numbers warrant that in West Virginia? Really? I'm asking. Okay. All right. Now, that brings up another topic about face masks. And I got beat up on this by a few people for my previous video on this before. And let me find this. Here is what virologists wear to protect themselves from a virus. Don't worry, though, your bandana probably works. And then there is this, which these were on the boxes for these things before they got taken off the shelf. And now you go to Walmart and they have boxes without this warning, and all the boxes with these in them are from China. And okay, this ear loop mask is not, will not provide any protection against COVID or other viruses or contaminants. Wearing an ear loop mask does not reduce the risk of contracting any disease or infection. Okay, I said that before, and people, some of you, yeah, I know who you are. You laughed at me. Okay, I will show you mine. You show me yours. Okay, all right. This is from the Association of American Physicians and Surgeons. Wait a minute, wrong one. Sorry, this one. And here, I would like to point out right here that the COVID particle is 0.125 micrometers. It's tiny. It's very small. Now let's scroll down and see what the Association of American Physicians and Surgeons says about this. And I'm getting there, getting there. Surgical masks are designed to protect patients from surgeons' respiratory droplets, aren't effective at blocking particles smaller than 100 micrometers. So, let me get off of that. It's got to finish playing. So what you have here is this thing blocks particles 100 times larger than the COVID virus. Still don't believe me. Okay, still laughing at me? Okay, what about May 21, Journal of New England Medicine? Universal masking in hospitals and COVID-19 area. We all know that wearing a mask outside healthcare facilities offers little, if any, protection from COVID. In many cases, the desire for widespread masking is a reflective reaction to anxiety over the pandemic. Oh my God, is that what it is that we're catering to the snowflakes now that want to feel good? We're closing down the businesses because we care about people's feelings instead of facts. Okay, all right. I got to admit, I may have missed one of the governor's press conferences where he quoted studies on the effectiveness of this. If you find out where his data is on the effectiveness on these masks or wood shop plastic masks, go to Piggly Wiggly. They got them there. And let me know and put your comments down there. Now, okay, so we don't have any definition of what a pandemic is. I would like to offer a suggestion on what the real pandemic in this country is. They should start reporting the number of kids that go missing every day the way they report COVID numbers. Maybe that would get people's attention. It's interesting. Again, I've tagged the governor in this. About 3 or 4 years ago, I was out doing a display for a local business I was working for and went into one of the sessions, and there a state senator got up on the floor and started talking about all the missing kids in West Virginia. I started thinking, well, how many kids are missing in West Virginia? And so, but I came home and I did a Google search, and I was stunned how many missing kids there are that go missing in the United States. And it's such a pandemic that we don't even know ourselves, or actually Google doesn't even know how many kids are missing. Okay, these two searches were done within 1 minute of one another. Okay, first one, okay, 460,000 kids missing every day. That's 1,260 a year. So that's 1,260 a day, or we're missing 5 plane loads of kids a day. That's like 5 plane loads of kids crashing and dying every day. 1 minute later, I did the same search. Oh my God, 800,000 missing kids. Google can't even. We got so many missing kids, Google don't even know how many we got missing. So 800,000 missing kids in this country alone. It's 2,191, or roughly 9 plane loads of kids missing every day. Right? So what is going on here? The real issue to me seems to be human trafficking. And the only one of our politicians that seem to have the balls to stand up now and talk about this is Trump. But you would be hard pressed to find his comments on human trafficking on any of the mainstream news. I mean, I even have to go digging for it to find it. And it is. Now, one of the things that Trump did was when this COVID virus hit, he started an action on the southern border going into Mexico and South American countries to stop human trafficking and illegal drug running funding. That's also part of the reason why he wants to build the wall. Okay? All right, now I've even had family and friends tell me, let's defund the police. That's what they'll say. Okay, it's interesting. The mayor of Portland got booed off stage when he said, I want to defund the police, but we're going to keep them funded. No. What these protesters want is complete elimination of the police. They don't want law and order. They want a total reconstruction of this country. And I think there's a much larger picture that's coming into play. Now, I want to end this video with the numbers, with the West Virginia COVID numbers and the missing children numbers. Now, without going into too much detail, I do think in the next few months, it's going to get a lot wilder in the United States as the left pushes back because they know their time is really up. They've had this thing against Trump trying to get him out for 3.5+ years. It's coming out now. You know, they spied, they lied. They were the ones doing this stuff. But yet only a third of the people believe it, even when hard evidence comes out like the Strzok memo. Okay, but unlike leaders like Mao and Stalin, we're following the rule of law. The patriots are. They're bringing evidence and the wheels of justice grind slowly. And I think that's why the left is going so absolutely nuts now. And I think these Black Lives Matter movement, which, by the way, if you support Black Lives Matter and supported them financially, that goes to Act Blue, okay, basically a shell company, and then it goes to Democratic political candidates, and that's how Biden can raise his money, which, by the way, I don't think Biden's going to be the candidate anyway. I think he's going to get replaced. Okay, but I'll leave it at that. Now, that's enough for now, because the mind can't perceive what it can't conceive. And I know for a lot of people that will watch this, this is a lot to process even right here. And for me to go any further for you right now, be far too much. Okay? So take time, process this. Now, some people like me wake up 4:30 in the morning, way before the alarm. Some people wake up when the alarm goes off and they're up there. Other people, when the alarm goes off, they'll hit the snooze button 3, 4, 5 times. But wake up, they eventually do. The alarm bell is ringing and people are waking up. Where we go one, we go all. Peace out.